Mikron Posterior Lumbar Screw System is designed for minimally invasive posterior spinal fixation. The system enables pedicle screw placement through an approximately 1.8 cm incision for each screw, helping to minimize soft tissue disruption. The MIS screws feature a quad-lead thread design and are available in cannulated and fenestrated configurations with various diameter and length options. The rods are available in lengths ranging from 40 mm to 120 mm in both curved and straight configurations. The set contains 4 instrument trays, 6 K-wires, and 1 screw tray. The patient is placed in the prone position on the operating table. A spine model is used for demonstration purposes in this video. First, the puncture needle entry point is identified under fluoroscopic guidance using the targeting plate. Before autoclaving the puncture pin, the protective silicone cap must be removed. The puncture pin is advanced into the pedicle through the entry point previously identified using the targeting plate. Once the puncture pin is positioned, its inner part is removed and the guide needle is advanced through the puncture tube. After the position of the guide needle has been confirmed under fluoroscopic guidance, the puncture tube is removed. If removal of the K-wire is difficult, the K-wire extractor included in the instrument set may be used. As the second step, prepare the 5 dilator sizes provided in the instrument set. 2 dilators of each size are included. Remove the puncture pins. Following removal of the puncture tubes, make an approximately 1.8 cm skin incision around each guide needle. Advance the smallest diameter dilator over the guide needle. Then, pass the second smallest dilator over the first dilator and remove the smallest dilator. Do the same step for all pedicles. With the second smallest dilator remaining in place, the pedicle entry is prepared using the awl. Attach the cannulated awl to the eye ratchet handle and advance it over the K-wire through the dilator. The forward and reverse functions are clearly marked on the ratchet handle. After the pedicle entry points have been prepared with the awl at all planned levels, the awl is removed. The procedure is continued with tapping. The instrument set includes taps in diameters ranging from 4.5 mm to 7.5 mm. It is recommended to select a tap 0.5 mm smaller than the diameter of the intended screw. The depth markings located near the proximal end of the tap allow the tapping depth to be monitored. Connect the selected tap to the eye handle and perform tapping over the guide wire. After tapping, the remaining 3 dilators are advanced sequentially over the guide wire. Once dilation is completed, the final plastic dilator is left in place. In the next step, the MIS tower is securely attached to the selected screw. The screwdriver is connected to the eye handle, and the screw insertion assembly is then attached to the MIS tower. The screws are advanced into the pedicles over the guide wires. After the advancement, screw can be released by turning the release handle in the screwdriver. Once the screws have been inserted to the appropriate depth, the guide wires and dilators may be removed. After screw insertion, the appropriate connectors included in the MIS instrument set may be used if required. The rod length is then measured. The set includes both straight and curved rod measuring instruments. It is recommended to select a rod approximately 10 mm longer than the measured length. The selected rod is removed from the screw tray using the rod holder. If necessary, the rod may be contoured using the rod bender included in the set. The rod is then secured to the rod holder and tightened using the rod holder tightening instrument. Depending on the surgical approach, the rod may be introduced through the same incision or through an additional 3rd incision and advanced through the MIS towers. After confirming the position of the rod, the connectors are removed and the rod reducers are attached to the towers. The rod reducer handle is then used to gradually reduce and seat the rod into the screw heads. Following rod reduction, the set screw is picked up using the set screw holder and inserted through the MIS tower. The set screw should not be fully tightened at this stage. The set screwdriver is then used for provisional tightening. Before final torque application, compression or distraction may be performed as required. The instrument set includes 1 compressor and 2 distractors. The anti-torque instrument is positioned over the top of the MIS tower. The final shaft screwdriver is connected to the 12 Newton-meters torque handle, and final tightening is performed until the specified torque is reached. Rotate the 12 Newton-meters torque handle until the second audible click is heard, confirming that the required final torque has been applied. After final tightening, the instruments except the MS tower is removed. If required, cement application may be performed before removing the MIS towers. The MIS towers are removed using the gun-type tower remover. The remover must be positioned laterally on the tower before activation. Finally, the incisions are closed, completing the procedure.